Hi, my name is Mark Bicket. I'm an assistant professor at the University of Michigan in anesthesiology and pain medicine. Today I'll be talking with you about COVID's impact on the opioid crisis. We're going to start by talking about how COVID-19 impacted individuals with or at risk of opioid use disorder. And then we'll talk about COVID's impact on opioid-related adverse events and opioid-related overdose deaths during that time. So first, let's start by talking about the impacts of COVID-19 on the general population, as well as those with or at risk of opioid use disorder. Social isolation certainly is not uncommon in terms of remembering the experience of what life was like after the onset of COVID-19. Whether it was work from home orders, shutdowns of the community, or social distancing measures, these all combine to limit the ability of individuals to interact with their friends, family, and loved ones. That resulted in a number of impacts that made life for individuals who are at risk of opioid use disorder less safe. Individuals who are using medications inappropriately may have done so in isolation as opposed to with other individuals or individuals in their community who could look out for them and offer them safety, which would then likely lead to increases in overdose deaths. Increases in stressors at the time also were common and have been documented, especially in surveys that compare anxiety, depression, or other psychological conditions from the time period before to during the onset of COVID-19. Additionally, access to treatment during the onset of COVID-19 was significantly limited due to these stay-at-home orders, as well as the shutdown of many businesses. With the disruption of clinic schedules and the shift to emergency care, which was often overwhelmed in responding to COVID-19, the ability of individuals to seek treatment, establish new care, and obtain access to medications for opioid use disorder was likely to be disrupted. Finally, it's important to acknowledge with all these three concepts that individuals who are vulnerable were likely to experience even worse outcomes as they relate to social isolation stress and the impact of access to treatment, given their less access to resources, as well as other supports. Now we'll turn to talking about opioid-related adverse events from the time period before versus during the COVID-19 pandemic. These fall into three different categories. So first, emergency medicine service utilization. Second, the impact of urine drug testing results. And third, naloxone rescue medication use. So for emergency medicine service utilization, we may recall that during the shift to COVID-19, many of the normal flows of care for patients with opioid use disorder or overdose were shifted from clinic settings, which were largely shut down, to the emergency room. And so here we look at ambulance calls and emergency department visits as they relate to overdoses, diagnoses of opioid use disorder, or other related events. For ambulance calls, when we examined studies that looked at how time periods from before versus during COVID-19 compared, we saw increases that ranged from 17 to 61%. And for emergency department visits, we saw increases that ranged from 42 to 155%. So two strong and consistent signals in all the studies that documented increases in both of these measures for emergency medicine service utilization. When we think about urine drug testing results, these are drug tests that are done in the general population to screen for illicit use of substances. Here on the left side of the screen, we see three different types of opioid products: fentanyl, heroin, and then a general category of opiates. And the yellow bars here are comparing the time period before COVID versus the blue bars that are the time period during COVID-19. And for these three types of opioid products, we see increases from the time period before versus during COVID. In contrast, these other bars on the right-hand side of the screen for cocaine, amphetamines, oxycodone, and tramadol did not show a change from the two periods. While that's one study, we have several other studies that corroborate this increase in opioid drug testing relative to other substances in the urine. So we saw increases in fentanyl documented in 6 studies with ranges from 34% to 138%. For oxycodone, 3 out of 4 studies showed increases ranging up to 44%. And for heroin, we saw increases in 4 out of 5 studies with increases of up to 62%. So again, for all three categories of opioids here, fairly consistent increases across the board. Finally, we make a comment about naloxone rescue medication use. Naloxone is an opioid reversal agent, so that when someone overdoses on an opioid and has respiratory depression, if we were to give someone naloxone, it would help stop that process from happening and help reverse the overdose event. In 2 studies that were published on this, overall, similar use was documented comparing the time period before versus over, so roughly no overall change in that use. This time we'll turn our attention to looking at opioid overdose deaths and compare the before versus during COVID-19 pandemic. So here's data from the CDC showing overdose deaths for all types of opioids. You can see the data starts from January of 2015, increases a bit up until January of 2019, and then plateaus up until the beginning of 2020, right before the COVID-19 pandemic started. At the start of COVID-19 in the United States, there were around 53,000 deaths, and this was in the March of 2020. For the next 24 months afterwards, we see a fairly sharp increase in terms of deaths here, setting new records with more than 80,000 deaths from opioids, concluding with this peak in the January of 2022 that's outlined here on the screen. We take a moment to look at a little more granular detail for the same data that was just presented. Here we see some different lines that indicate different types of opioid medications. And this brown line indicates synthetic opioids. So these are opioid medications that are often like fentanyl or fentanyl derivatives. And you can see from this that they account for the vast majority of all opioid overdose deaths, with roughly 7 out of 8 of those deaths in January of 2022. And the majority of the rise here over the last 2 years has been attributed to synthetic opioids. These are often illicitly manufactured, not necessarily prescription fentanyl, but these illicit fentanyl derivatives. We've also added in deaths from other causes on this graph, and here we can see increases in other drugs that result in overdose, these psychostimulants, more than 33,000 deaths in January of 2022. This is important to note because of the rise in overdose deaths that involve multiple types of drugs. Not just opioids, but we're seeing a number of opioid overdose deaths involving multiple agents, not just one type of agent, and psychostimulants are part of that. Opioid overdose deaths also have shown a great deal of variation by race and ethnicity. It's important to note that data on race and ethnicity for opioid overdose deaths hasn't been collected for as long as the opioid epidemic has taken place. Here we can see that line at close to wave 4 emerging in 2019. Those are all data points taken prior to the onset of COVID-19. And then we can see the most recent data points illustrated here with the numbers for the 2020 that include the time period after COVID-19. And between the 2019 and 2020 period, we see these sharp increases in all types of overdose deaths by race and ethnicity. Here at the top, we see Native American or Alaska Native populations that have the highest overall opioid overdose death rate, right next to those who are non-Hispanic and Black patients. For these populations, above the 26.5 or 26.6 line there. We can also see that Hispanic and Asian or Pacific Islander populations, while they're lower than non-Hispanic whites, have also had sharp increases in terms of the opioid overdose deaths. Regardless of the race and ethnicity, increases across the board. So in conclusion, for opioid overdose deaths, we see a great increase in their number after the onset of COVID-19. These synthetic opioids like illicit fentanyl represent the vast majority of the rise in overdose deaths, but we're also seeing the rise of opioid overdose deaths in combination with other types of substances, including methamphetamines. And finally, we've seen that the impact of COVID-19 has impacted overdose deaths on diverse groups with acceleration among all types of groups that we're able to classify.